Many Americans live every day with diabetes, treating that diabetes. At the same time, the staff at Trinity Health is looking for ways to treat diabetes. And Dr. Cyprian Gardine is an endocrinologist at Trinity Health. He's doing that every day. Thanks for joining us this morning.
Thank you for having me.
What's the state of diabetes? I did some research. It seems like it's still growing. Diabetes in this country, prevalent. Is it growing rapidly?
Sure. There about 10% of the population has diabetes, so that's over 38 million people.
That's a lot of people.
So definitely it's growing. And so definitely it's one of our major health care conditions in this country.
So how is it being treated? Obviously insulin, that word gets used a lot when it comes to diabetes, and new and exciting ways of treating diabetes. What has Trinity Health been up to?
Sure. So over the last 20 years, there have been major developments in the management of diabetes. So in the past, all we had was insulin. But now we have numerous classes of oral medications. We have all sorts of technology in the ways of monitors and pumps and things of that nature to help provide individualized care for our diabetic patients.
And this has really become healthcare more personalized. Is it that way with the treatment of diabetes as well?
It certainly is. As we've gained more classes of medications, we have ways that we can treat patients' blood sugars that also address other comorbid conditions like cardiovascular disease or kidney disease or things like that, issues with weight and things of that nature. So all those are often present in our diabetic patients, and many of our medications help to address all of those things at the same time.
Obviously, these new medications and new ways of treating diabetes from Trinity Health are important, but the basics are still the same. Can you talk about the basic steps that people can do to prevent diabetes, or at least treat it?
Certainly. The foundation of all this is lifestyle changes. So things addressing diet, having a healthful diet, regular activity, exercise. That's the bedrock and where we start. And added to that, we can have individualized care with medications, with treatment plans, and so we sort of layer on that, and then the technology helps us even further. So all those things we can utilize to help treat our patients.
Now, you've mentioned quite a few things there. You've got the diet that you can do, the medications that you can take, and the new technology that Trinity Health has at the ready. When it comes to medications and technology, that is an important part that Trinity Health brings to it. You mentioned the lifestyle changes. Is there something, a certain food? Is there a certain food that you shouldn't eat? Or a certain food that you really is like, we hear about blueberries being like a powerhouse for cancer fighting. Is there a powerhouse food out there for diabetes?
Well, you know, I caution to say any one thing because everyone is so different.
Sure.
And I think the maxim that moderation is important. You want to try and choose the best whole foods you can. You know, money can be an issue, and affording different foods can be an issue. But basically, you want just a healthful diet and trying to balance that with, you know, vegetables, lean meats, things like that.
Yeah, the things that you've heard your
before,
whole life,
over
right?
and over.
But to actually put them into practice is so important, especially when it comes to diabetes. And then lifestyle and exercise is important there. Now let's switch over into your world, this new technology, these new medications. Is there anything new and exciting that has got you excited about treating diabetes?
Oh, sure. I think there are a few big innovations that have had huge impacts on our patients. One of those are the continuous glucose monitoring systems. So patients can now wear devices that are very small that can measure their blood sugar every minute, every 5 minutes throughout the entire day, which helps them sort of navigate this road and say, I'm going to eat this, or I'm not going to eat that, or maybe I should go for a walk or something like that. So it just provides a wealth of information that a person can utilize to help treat their diabetes.
And before they weren't, I mean, before you had to wait, or you were doing
we had to prick your finger, which often was painful.
Right. So that really has improved.
And few people are going to check every minute and prick with a finger stick.
Right, but so, the more information you have, the better decision you can make. Absolutely.
Exactly. And then layered on that is all the medications. So the big things are these new medications that really target issues in diabetes, and they not only treat blood sugars, but they help with weight loss, they help protect your kidneys, things like that, which is paramount for our diabetic patients.
Absolutely. So all of these medications are available right now, and Trinity Health would love to treat the diabetes that maybe you are watching right now have. But if there was one thing, one piece of advice, your elevator pitch for somebody who is like, hey, what's the one thing I can do to really help manage this?
Yeah. So I think we think of diabetes, it's a chronic disease, so it occurs over your entire life. So really trying to be proactive and making small changes that you can maintain for a long period of time. So little investment here now will have huge dividends 20, 30 years down the road. And just continuing to do your best to try to maximize your health.
Yeah, don't wait until that moment when, oh, now you've got to get to the doctor. Take those steps now. And of course, if you want more information, Trinity Health, your website, has just a wealth of information waiting.
Definitely.
Absolutely. Check them out online. We'll have a link on our website as well. Thank you so much for the time this morning, Doctor.
Thank you so much. I appreciate it.
You bet.